Hey everyone, and welcome. Health advice is just everywhere these days, right? It's on your phone, your social feeds, and definitely in those family WhatsApp groups. But here's the thing, how much of it can you actually trust? Well, today we're going to dive into how AI is stepping up as this really important partner in the fight for our digital health. So let me start with a quick question for you. In this totally connected world we live in, what do you think spreads faster than an actual virus? Any ideas? Yeah, if you guessed a viral message, you are absolutely right. And we've all been there, haven't we? You get that WhatsApp forward from an auntie swearing by some miracle cure made from, I don't know, kitchen spices. Or you see a tweet just screaming danger about some new disease. It's like a digital wildfire. And honestly, it's way more than just annoying. It's a real serious threat to our health. Now, this chaos isn't just random. There's actually a science to why lies seem to grow wings while the truth is, still tying its shoelaces. So let's get into the anatomy of an infodemic. So the World Health Organization actually has a name for this crazy information overload. They call it an infodemic. And you know that feeling, right? It's like you're drowning in all this conflicting information and you just don't know who or what to trust. And that confusion, it's not harmless at all. It can push people to make really dangerous choices, and it slowly eats away at our trust in actual doctors and scientists. Okay, so it's super important we get our terms straight here. There's a huge difference between misinformation and disinformation. Misinformation, that's like when your uncle shares an article he genuinely thinks is helpful, but oops, it's actually wrong. It's an honest mistake. But disinformation? Oh, that's the nasty stuff. Those are lies created on purpose, to scare people, to divide us, or just to make some quick cash. So why do these lies spread so much faster? Well, this chart here, the viral curve, tells the whole story. Look at how that rumor, the red line, just shoots up like a rocket. And the blue line, the actual fact check, it barely gets off the ground. There's something called the novelty hypothesis that explains this. Basically, false news is often way more emotional, more shocking. It's just juicier, right? It's like gossip. We just can't help but share it. The truth? Well, sometimes it can be a bit boring. Kind of like being told to eat your veggies. Okay, so how on earth do you fight a fire that's literally designed to spread? Well, you have to get smarter. And this is where our new secret weapon comes in: artificial intelligence. Public health experts are moving from just broadcasting information out to actually listening to what's going on. And this image really shows the new playbook. The new strategy is called infodemiology. Seriously, think of it like disease surveillance, but for information. Using AI that can actually understand human language, that's the whole natural language processing thing, experts can scan millions of posts online in real time. They can literally see on a map where, say, whispers about vaccine hesitancy are turning into a full-blown roar. Or they can spot where people are suddenly talking about flu symptoms, sometimes weeks before anyone even shows up at a clinic. It's all about being predictive, right? Getting ahead of the problem instead of just cleaning up the mess afterward. And really, the superpower here is speed. I mean, AI can sift through these absolute mountains of online chatter to find that one critical tweet or that one post that signals a whole new health trend. It's basically like having a superpowered assistant who's listening 24/7, helping us figure out what people are really worried about right this second. All right, so AI isn't just about this big picture surveillance. It's also becoming your own personal health coach, right in your pocket, ready to help you make smarter choices every single day. Let's take a look at how this actually works. I'm telling you, AI chatbots are a total game changer. Just imagine having a health expert available for you 24/7 right on your phone. They can help you track your meals, remind you to take your medicine, and even be your personal cheerleader if you're trying to quit smoking. And you know what the best part is? You can ask them anything at any time, and there's zero judgment. Just look at these examples. On the left here, there's an app that can build you a custom workout, even if the only thing you have is a chair. And on the right, here's another one that helps you find diabetic-friendly recipes for foods you actually love, like Italian. It's all about using this smart tech to make healthy living just a little bit easier and a lot more personal. And the data on this is pretty clear. A big review of AI health chatbots found that a huge 73% of them use what's called behavioral monitoring. So what does that mean? It means they're not just spitting information at you. No, they're actively tracking your progress and giving you feedback. It really is like having a coach who's always paying attention, and that's what makes them so effective. Okay, but let's be real. It's not a perfect fairy tale. AI is an incredibly powerful tool. But you know what they say? With great power comes great responsibility. So now we need to talk about the tough questions and the real-world challenges. especially when we start looking beyond the wealthier parts of our world. Probably the biggest hurdle is something called the infodemic equity gap. And to put it simply, all these fancy AI tools that work great where you have amazing internet, they're pretty much useless in places where people have basic phones and speak dozens of different languages. For so many people, the main source of health info is WhatsApp, which is basically a black box for public health officials. They have no way of seeing what's being shared inside those groups, let alone how to counter any of the lies. I mean, just take a country like India. You can't just translate a health message from English to Hindi and call it a day. It doesn't work like that. You've got 22 official languages and hundreds of dialects. A one-size-fits-all approach it's doomed to fail. The real key here is combining technology with local wisdom. The message has to come from people the community already knows and trusts. A local doctor, a community leader, maybe even a popular creator they follow. At the end of the day, technology is just the tool. Trust is the foundation. And this is exactly why big organizations like the WHO have laid down some really important guardrails. Think of them as the rules of the road. And they're pretty simple. AI in health has to respect our autonomy, our choices. It has to be transparent about how it works, it has to be fair to everyone, and most importantly, it has to do no harm. The goal is to use this amazing technology to close the gaps in healthcare, not make them even wider. So, where do we land on all this? What's the final verdict? Is AI the hero we've all been waiting for? Or is it some new kind of villain in disguise? Well, the truth is, it's neither. AI is just a tool, a really powerful one, but it's completely up to us how we choose to use it. The future of health isn't about robots replacing doctors. It's about humans and AI working together to build a healthier world for everyone. Okay, so if you're going to take away just 3 things from our conversation today, please let it be these. Number 1, the infodemic is a real systemic health threat, not just some random rumors online. Number 2, AI gives us these incredible new tools for both large-scale surveillance and for personalized health support. And number 3, and this is maybe the most important takeaway of all, technology alone is not a magic bullet. For any of this to work, it has to be guided by ethics, by equity, and by a deep, genuine understanding of human culture. And all of this really leaves us with one final big question. In this new digital future, who's actually responsible for our information health? Is it the big tech companies, the government, or does it start with us, with the small choices we each make every single time we decide to click share? That's a question I think we all need to answer together. Thanks so much for joining me.